begin the procedure, I'd have to do some assessments on my patient. I'd have to assess the patient's overall condition and also their ability to cooperate throughout the procedure and to lay still. I also need to make sure that they can lay in that supine position that's comfortable for them. I'd also assess their the last time that they voided or the last time that they were catheterized. Also have to verify patient or physician's orders that this patient does need a catheter and that this is the right type of catheter, right size, and things of that sort. So before I begin, I'm just going to make sure I have all my supplies assembled. I have my hand hygiene, my tape, and my sterile catheter kit. This one obviously is no longer sterile because I practiced with it, but in the clinical setting, each patient gets a new sterile catheter kit. And then I have my patient model here, and I'm doing a female. Okay, so to begin, I would enter the room and start by performing hand hygiene. And I would introduce myself to the patient, just say, hi, I'm Emily, I'm going to be your student nurse today. And then I would verify their name and date of birth based off the records that I have and their wristband, also verify any allergies. I would explain the procedure to the patient, just let them know that I will be placing a catheter. It seems like they're having some trouble avoiding, and this is just going to help to drain their bladder. Make sure that they understand that and make sure that they're willing to cooperate for the procedure. I would also provide for patient privacy and raise the bed to waist height for me to place this. Obviously, in the circumstances, I don't have a waist height surface. I would also assess the bladder for distension or fullness, which would indicate needing that catheter. So once I've explained the procedure, provided for privacy, and set my bed to waist height, I would be ready to open my catheter kit. So to do so, I'm going to take it out of this plastic bag, and I'm going to open this bag so that I can use this for trash. I'm going to set that over here, and then I will begin to open my kit. I'm going to take it top flap away from me first. Then I'll open the sides. I'm going to scoop this up a little bit. And I'll pull this one back towards me last. The first thing we'll have to do is place this waterproof drape underneath the patient. I'm going to open it with the shiny side towards me because that's the side that will lay flat, and I'm just touching the outer 1-inch border to try to keep that sterile. Now it's going to be a little tricky crossing over my patient here, but I'm going to place this under what my patient's hips would be. In the clinical setting, it may be helpful to have another nurse help me do this. And then I can dispose of this other drape because I will not be using it. And then I will get my sterile gloves out of the box. Before I put those on, I'm going to perform hand hygiene. And I'm actually going to backtrack here for a second. I just realized I forgot to position my patient. That's one of the important things before you catheterize someone. For a female patient, they would have to be supine, like I said, with their knees flexed, their feet about 2 feet apart, and then their hips rotated outward. And also before, I would make sure that they didn't need any perineal care for any gross contamination. My patient here today doesn't need that. So since I've stopped and talked, I'm going to hand hygiene one more time, and then I'll be putting on my sterile gloves. I'm going to start by opening them, touching just that outer 1-inch border. Now I'll glove my dominant hand first. I'm going to grab the cuff and step back. Okay. And then I'm going to grab the cuff of the other glove. Go straight up and back. And glove that dominant, or the other hand as well. So now that I have my gloves on, I'm going to step over here. I'm just going to kind of move that onto the floor. And I'm going to keep my hands above my waist at all times. So I'm going to grab my tray, and I'm going to set that out onto my sterile field here. I'm going to move my forceps. I'm going to set them on my sterile field over here out of the way. And without crossing over, I'm just going to put my antiseptic solution on my cotton balls, and then I'll throw that away. I'll take my lubricant and open that up, and then also put that into my tray and throw that away as well. I can also get rid of the specimen container. Okay, so now that I've done that, I'm gonna take my syringe of fluid, and that would have landed in the trash, hopefully. And then I'm going to connect this syringe to the tubing. And I will also lubricate the tip of the catheter, and then I will leave it rest in the tray. Ooh. And then I can just place it back into the sterile tray. Okay, so now I will start cleaning the patient's perineal area. I'm going to pick up one cotton ball, and then once I place this hand, it is contaminated, so I will not be moving it. I'm going to spread the labia, and I'm going to clean top to bottom on one side, and then I will discard that. I will take another cotton ball and clean top to bottom on the other side. I will take a third cotton ball and clean down the middle, top to bottom again. And then I'm going to clean the meatus with one more cotton ball. I'm just going to do one circular motion around it without crossing over the path that I made. Okay, so I can now toss my forceps as well. So keeping that hand in place, I'm then going to grab my catheter. I'm going to hold it about 2 to 3 inches from the tip, and I'm going to begin to insert it after I ask my patient to take a nice deep breath, and as I insert it, they can exhale. So I will insert the catheter until I see urine in the tubing, and then once I see that urine, I can advance 1 to 2 inches more. Once that is in there, I will take my sterile hand to grab my syringe, and then using this other hand, I'm going to keep it on my patient's perineal area, but hold that tubing in place so I can inflate my balloon. Okay, so once that is done, I'm going to grab that syringe off and throw it away. And then I'm just going to give this a little tug to make sure that balloon is inflated. It seems like it's inflated. I've met the resistance there, so then I'm going to remove my hands from the area. If the patient said that it was uncomfortable or they were experiencing any discomfort, I could then withdraw the fluid, advance the catheter a little bit further, and then try to re-inflate that for them. I would, at this point, take my tubing and attach it with some tape, this leftover tape here. I have this here to signify that I would tape this to my patient's thigh. For a female, it would be taped to their inner thigh with just a little bit of slack. Since I don't have a non-movable part, I'm not going to be taping it, but I do have tape here, and that's kind of just to signify that I would do that. I would also take the bag, the collection bag, and my patient likes to run away on me here. I would I would hook it to a non-movable part of the bed below the bladder level. Make sure there's no kinks or anything in the tubing. I'll set that down here. Okay, and I'm trying to keep this from moving. Okay, so now that I have the catheter in, it's comfortable for the patient, and I have the collection bag hung, I would then provide any perineal care that is needed to cleanse any of the antiseptic or lubricant off of the patient. I would then also put them back into a comfortable position. You can unflex the knees and things of that sort, and also lower the bed back down. After I've done that, I can start to discard my supplies. I can take my sterile gloves off and discard all of this in the proper receptacle. I can take the drape out from underneath, and I can do hand hygiene. Once that is finished, I can document the procedure, documenting how it went, how the patient tolerated it, and record any urine volume or color or odor that I noticed throughout the procedure.